Hello, my name is Lisa Carnes. This is my Family Theory Assessment presentation. It is on Dorothea Orem's Self-Care Deficit Nursing Theory. Orem's Self-Care Deficit Theory is also known as Orem's Model of Nursing. There are actions that are needed to support the patient in acting on their own needs to manage self-care activities, instead of relying strictly on nursing staff for all their needs. The model focuses on the individual and their ability to perform self-care by initiating individual activities to maintain their life, health, and well-being to help them recover and heal more quickly. Primarily it is used in primary care settings, also in some rehab centers, but it can also be used in a broad area of different practices across healthcare facilities. Self-care is the most important because it determines when care is needed, and it also helps with the families that are involved so they can help learn how to act when their family members are ill. There are three components to the self-care deficit theory, and they include theory of self-care, theory of self-care deficit, and theory of nursing system. Key concepts. There are three interrelated theories in Orem's model of nursing. The first one is theory of self-care. This is activities that an individual can perform and initiate for themselves independently to maintain their own health. Theory of self-care deficit is when an individual is not capable or limited of meeting their own self-care needs. This is when deficits occur. And then this is when a person can benefit from nursing care. Theory of nursing systems is how the self-care deficit will be met by the nurse. It can be partially, fully, or educational supported. Key concepts continued. Out of the three interrelated categories of Orem's model of nursing, the first one I'm going to talk about is theory of self-care. This entails self-care requisites. The first one is universal self-care requisites. These are the activities an individual will initiate and perform on their own to maintain their life, health, and well-being. These include sufficient intake of air, water, and food, elimination, rest and activity, and human functioning. The second is developmental self-care requisites. This includes developmental processes. The first one is provisions that promote development, engaging in self-care development, and prevention and overcoming life situations that can affect development. Health deviation self-care requisites include when an individual who is ill or injured seeks and secures appropriate medical assistance, being aware for pathological conditions. Key concepts continued. This is the second of the three interrelated categories of Orem's nursing model. Theory of self-care deficit. This is when an individual is not capable of meeting their own self-care needs. This is when deficits occur. There are 5 methods of helping that are included that nurses are required to meet these demands to help them with their self-care needs. The first one is acting for and doing for others, guiding and supporting others physically and psychologically, providing an environment for patients to meet demands, and also teaching one another. Nurses can use all or some of these to provide self-care needs. The third concept applied is theory of nursing systems. 3 classifications to meet the requisites by the nurse, patient, or both formed by actions within nursing agencies when there's a self-care deficit. The first is partially compensatory. Patients can perform some but not all self-care needs. Wholly compensatory is when a patient is unable to perform all self-care needs. And supportive educational system is when patients can perform all self-care actions. The major concepts of Orem's self-care deficit theory include the 4 nursing meta-paradigms. Person. It's integrated including men, women, and children to engage and provide self-care to others using self-knowledge and engagement, functioning biologically, symbolically, and socially. Health. It encompasses the health of the individual and family and/or group. It is structured, functionally whole or sound. It allows reflection on oneself, experiences, and communication with others. The environment. It is physical, chemical, and biological conditions that motivate a person and family to achieve goals. It includes the whole family, culture, and the community. Nursing. This is a special art. It's a helping service to assist persons with disabilities in meeting needs for self-care so they can recover and heal more quickly. The analysis of Orem's self-care model is applied in family practice settings based on the needs of an individual and distinct services that nurses provide to meet self-care needs by using knowledge and teaching they developed from their field of nursing practice. This model is used by nurses in various family care situations to collect information and determine what self-care needs need to be met to promote life, health, and well-being to recover and heal more quickly. There are numerous steps to follow using this model to provide self-care needs. The first one is gathering basic data. This includes age, gender, developmental state, their health state, and external environmental factors. The next is identifying self-care demand. Identifying actions that need to be performed to meet requisites that we talked about earlier in the presentation. Next is to determine self-care agency, determining what knowledge is needed, decision-making with what resources that are available, and performing them to meet self-care needs. Next is determining the self-care limitations. When we determine this, we determine what knowledge is needed to make decisions about the patient's care. Next, we're going to design and plan a nursing system. After limitations are determined, the nurses plan and guide patients by designing a nursing system for the patient. And lastly, includes treatment, regulation, case management, and evaluation of the situation. These are two nursing research studies that I found that were applied using Dorothea Orem's self-care deficit theory. The first study was based off of symptoms and self-care strategies during a 6-month time frame after radiotherapy for prostate cancer patients. The first one entails capturing symptoms that are significant to the patient and healthcare professionals and reporting them to determine what self-care is needed to improve their quality of life during the radiotherapy. The methods used were using interviews to interview the patients, healthcare professionals, and reviewing the literature. The findings were that common symptoms were reported, including urinary and bowel problems. Those were the main ones that they focused on. But not all self-care needs were reported in the literature. One self-care need that was the main focus was the urinary problems. This is where the nurses played a role in suggesting healthcare needs, and that would be to adjust fluids, for example, like avoiding certain drinks before bedtime. Patients reported it was sometimes difficult to reach healthcare professionals, so self-care needs were not always reported. In conclusion, in the study, they determined that they needed some sort of applications so patients could report these self-care needs that they needed to be addressed. And so they decided to come up with a program or a platform called Information and Communication Technology. And they use this so patients can report increased symptoms and determine what needed to be done for the management of their self-care needs. The second one is spirituality, self-care practices as a mediator between quality of life and depression. This one focused on the use of spiritual self-care practices to improve quality of life and depression in African American patients diagnosed with heart failure, or it could be used for chronic illnesses as well, based off of Orem's self-care deficit theory. The methods included using a 36 questionnaire question sheet that they used to determine what kind of practices were these patients using. The findings concluded that depression coexists with chronic illnesses like heart failure, which can lead to difficulties in self-care deficits. It was determined that by using spiritual self-care practices like praying and Bible studies, this could help decrease depression and improve quality of life in certain ethnicities. African Americans are more likely to use these different religious activities than Caucasians, though. In conclusion, nurses and healthcare professionals should encourage all ethnicities, including all walks of life, religions, cultures, whatever it may be, to practice spiritual self-care to promote better outcomes in patients with chronic illnesses. The limitations of this study was using one ethnic group in one chronic disease. These practices can improve health, spiritual well-being, and better outcomes in patients with chronic illnesses. In summary, I will apply Orem's model of nursing for my family assessment because there are self-care activities that could be suggested to improve life, health, and well-being. The family chosen has a family member with prostate cancer and other chronic illnesses that are causing depression within the immediate family unit and could benefit from nursing interventions to meet self-care needs. I will first gather basic information, identify self-care demand, determine what resources are available and what limitations there are, and design a plan for the family unit and give an evaluation of the findings using Orem's model to promote recovery and healing. Here are a list of my references. Thank you for watching my presentation.